is Dr. Kavitha Krishnan. I am the founder and pediatric occupational therapist at Healing Synergy, which is a pediatric therapy clinic based in North Carolina. Healing Synergy specializes in occupational, physical, and feeding therapy for children with sensory issues, special needs, and feeding difficulties. What we do is we customize home programs to meet your child's needs, strengths, and the treatment goals. Should you have any issues or if you would like to inquire, please reach us through our contact page at healingsynergyllc.com. We look forward to hearing from you. Thank you. Hi, everyone. My name is Dr. Kavitha Krishnan. I am the founder and pediatric occupational therapist with Healing Synergy. This podcast is a series here to help and act as a guide for parents of children with special needs and sensory needs with practical and real-life tips and strategies that you can implement in your home. And as always, myself and my team of experts are here to help you. And should you have any questions, please don't hesitate to leave your questions or comments below so that we can help address those questions. I'm really excited today that you're here. And so let's jump into today's episode. I have here with me Dr. Chinno Ingram, who's also a clinical assistant professor at Winston, Salem State. And I am going to hand it over to him because he has a child with special needs who's now a young adult. And he's going to talk to us about his journey through this process and also, very importantly, financial legacy. That's a question that pops up a lot with the clients that I have, or parents of children with special needs, what to do. But here we have Dr. Ingram, who will walk us through this process. So welcome, Dr. Ingram. And thank you for joining us today. Can you tell us a little bit about yourself and your son?
Okay. So again, my name is Chinno Ingram. Work at Winston-Salem State as a clinical assistant professor in the Department of Occupational Therapy. And I think that's a very important opening or beginning to what I'm going to share today, is because prior to my son being born, I had no interest in healthcare. Healthcare was not on my radar. I actually worked in the utilities area, which focuses on water and sewer lines, and I was a equipment operator. And so what I noticed early on, once my son was diagnosed with cerebral palsy, is that it required a lot of time of the parent going to different appointments, different types of screenings. And then once he was diagnosed, the early intervention aspects of it, getting that weekly PT treatment, weekly OT treatment. He was in an early intervention program as far as the school system to really try to get him up to speed. So by the time that he was going into kindergarten, he would have the tools needed to participate in a regular classroom as much as possible. And so my son, whose name is Chinno Ingram Jr., or we call him CJ, he really introduced me to the field of occupational therapy and physical therapy. And
Can I ask you, I'm sorry to interject, but do you know at what age that he got the diagnosis?
I want to say it was around 18 months. Wasn't early on. And then later I found out that as the brain is forming, you really can't see that there's issues until it forms. And so that's why the diagnosis was much later. Me and my wife saw that he couldn't do some of the things that was typical. CJ falls in the middle of our kids. We have 5. So we knew what age he should have been sitting up, what age he should have had head control, been able to pull up at a table, and he could do none of those things.
Can I ask you, was that identified by through well-check visits, or was it something you both noticed and then brought it up with the doctor?
Yes, we both noticed, brought it up at the doctor, and that's what got us the referrals to the neurologists, the specialists, the pediatric specialists, and then some of the community programs that was out there.
Dr. Ingram, I have one other question, something that kind of pops up with a lot of parents as well. So at birth, nothing was brought up. When the baby was born, he was healthy.
No. I want to back up a little. Now he was born early. He was premature.
Okay.
So I want to say around 26 weeks. So
Okay.
quite
Okay, that's
premature.
early. Yeah.
Yes, quite premature. Definitely underweight because of the prematurity. So he spent a lot of time in the NICU early on.
Can I
Um,
ask you how long do you remember?
I would say he spent maybe he was discharged from the NICU around the time that a typical pregnancy would deliver. So
Okay.
maybe 2 months,
Hmm.
2 months and a couple of weeks.
Okay.
Yeah.
And when he left, it's so important because a lot of our families have babies coming from the NICU as well.
Mhm.
Um, so when he was in the NICU, do you remember, was he able to feed by himself? Was it an oral feed, NG feed? What was that like?
Oh, well, he was actually doing some oral feeding.
Okay.
There was some NG feeding. Um, and he had several procedures that had to, as far as um, he had a cut down, which was a surgery where that they could put an IV in. He had to have blood a couple of times. So a lot of things that was going on early on. My wife is a nurse.
Okay.
Um, so she really was the strong person in this, I would say, because she knew what a lot of these things look like. Whereas me, when you go into a hospital, you're already apprehensive. But then to go into a NICU unit and see all of these leads and lines hooked up to this small baby, I mean, it really puts a lot of stress on you.
I guess the advantage here would have been that your wife was a nurse already. And I'm so appreciative that you talked about even you being a little bit apprehensive. Um, so the techniques of handling the child when the child transitions out of the NICU, was that something your wife helped you with, or were the nurses telling you about that?
Yeah, so we did get a lot of information from the nurse. There was a nurse practitioner who was familiar with my wife. So as far as handling the child, the different techniques, as far as doing kangaroo, where you would come in, you would take your shirt off, and the child would be skin to skin with you,
Right.
which is not only cuddly, but also very needed for the child.
Right.
The environment, talking about how the quiet environment, because the child is so small that just little noises can really make them jumpy.
Right. And you said it was after 2 months that the baby came home.
Yes.
So because the baby, came home after 2 months, was your wife at home to look after the baby, or who was at home to care for the child?
Well, at that time, I worked second shift. So I stayed home during the day. My wife worked. Um, but of course, she had time off from work initially because
Yeah.
I don't think I could have did it. I wouldn't have knew everything to do. And then she was breastfeeding, of
Okay.
course, and
Okay.
pumping. So I'm sure that helped out a lot as well by him being able to breastfeed early on.
Yeah, this is like so important because of the transition from the NICU to the home, and especially new parents who have this baby and they're like, now what do we do? We've got all this knowledge, but it's really nice that you also had somebody who's also experienced,
Oh, yeah.
being in the house. And that's actually really powerful what you talked about, because as a father who has to look after, and because I do early intervention, when I go into the homes, just like yourself, there's a lot of parents who have to do tandem because they're working. So one parent, they just take different shifts to look after the child. Did you have
Yeah.
family as well helping out?
Yes. So both of our mothers lived in this area. So we did have help. We had a great support system. But everybody had their own work schedule. Her mom was still working. So we couldn't just drop everything. One other thing that I wanted to mention is even the ride home was somewhat learning curve because we thought we could just get a regular child seat. He was too small for a regular child seat. So there was a special car seat. And then he had to do the test where if he was sitting up in the car seat, could he maintain his O2 sets?
Right.
And without the head control, which we didn't know at that time, he fell. So he had to have the special car seat.
Okay. And did they provide like a special car seat? Where did you get
No,
it?
that was something that we had to pay for. Like
Okay.
right as we thought we were leaving out of the hospital and we thought we had everything covered, we had to make a purchase for that special car seat, which they carried in the store that was downstairs in Forsyth Hospital.
Okay.
So,
And the test
that
was done. So the test was done just before you left as well for the baby.
Yes.
Wow.
Yes.
Okay.
Yeah.
I didn't know that. I always thought I knew about the car seat, but I didn't know at what time that was happening. So that's really
So
interesting.
they may have done the test a couple of days before, and then we would let him sit in the car seat to kind of get him acclimated to it.
Right.
And then on the day of, he actually tested again, and the test still didn't go well.
Okay. That must have been nerve-wracking for you.
Oh, it definitely was. It was definitely nerve-wracking because everybody is ready to go. Everything is packed up.
Right.
And someone mentioned they do have these special car seats and they may have them downstairs in our facility. And so we purchased one of those car seats. We got him bundled up. We took him home. I can remember riding in the back seat with him. Yeah.
Oh, wow.
Yeah.
How did your children, because you had two other kids, right? Older to him.
Mm-hmm.
How did they respond?
Oh, they were just happy, another brother. Of course, at this time, we didn't know anything was going on. He was just premature at this time.
Okay.
Cerebral palsy was not on the radar at this very moment. And so they were happy, of course, all around, willing to support wherever they could, going getting bottles. And bottles were so small because of his size.
Right. Yeah. Just out of curiosity, do you still have the bottles or have you?
I think we may have one or two bottles. Another thing is the nurses love CJ from the beginning. I mean, I'm sure they love every child, but they would dress him up every day. Every day he would have a different outfit. And there was an organization that would knit the little hats that they wear and the little booties.
That's awesome. I do know the NICU nurses get very attached to the babies.
Yes.
Yeah, so that's awesome. So he comes back home, and you think everything is going to go on as usual. And when do you kind of notice that there might be some difference?
Probably around, I would say 6 months, and that's adjusted, of course, for his time in the NICU. So now once he comes home from the NICU, that's the time a typical or normal pregnancy would have delivered. So 6 months after then, we noticed that a lot of the things that he should have been doing, he wasn't doing. And of course, we had knowledge of what the normal pregnancy looked like, the normal development looks like because of our other kids. Right. My wife probably knew because of her textbook knowledge, but I had no clue because I hadn't went to school for OT at this time.
Right. And so you said about 18 months, you were able to kind of identify that.
Yes.
And so you had the neurologist check, and then you had the diagnosis given at that time?
Yes, so we got the diagnosis, and CJ has cerebral palsy, but he has a mixed type cerebral palsy where he could be very spastic at 1 minute and then very limp or limber at another time. Okay. Yeah, so it fluctuates. And so I guess that's the reason why it was so hard to detect that something was going on, because sometimes he has normal tone.
Right. Mm-hmm.
And those fluctuations are still present today.
Okay. But like you said, you jumped in and you got the early intervention services, and then you got into school as well. Okay.
Mm-hmm. Yeah, got early intervention services. We had a specialist that will come out to the house. I think she may have came out once every 2 weeks or so to really just see what he was able to do to provide us with support on things that we may benefit from other agencies. And so with that was very important because we didn't realize that school could start earlier for him. And so with the information that she provided, that was very helpful. So we did have a child friend who, my wife's friend, her mother was a very good babysitter. And so she had kept our other kids. Okay. And so once CJ, we felt comfortable that he was old enough, his routine was somewhat set, she started keeping CJ for us.
Oh, that's great. So you had a caregiver too. I mean,
yes. So we had a caregiver. We would take him to her home. My schedule pretty much got back to normal. The early intervention specialist would come out and work with CJ at her house prior to him going to the school.
Right. Yeah, that's right. Because we do go to wherever the daycare is.
Yes.
So it's either the daycare or the home daycare. That's awesome. Okay. And then when did you start? So with the equipments, you said it sounds like the coordinator, the early intervention coordinator, was helping out with equipments and schooling and different kinds of resources, correct?
Mm-hmm. And so early on, I mean, the equipment, so let's say I'm trying to think of the chairs, like the Rifton chairs, or the positioning chairs, the feeding chairs.
Right.
Early on, that was an out-of-pocket expense because he had a diagnosis, but he wasn't connected to a PT or OT that could make a referral for the equipment. Therefore, insurance wouldn't pay for it just because we thought we needed it.
Right.
Typically, that type of equipment comes through a referral from a clinician, and then the insurance will cover it.
Right. No, that still happens now. Yeah.
Yes. And so a lot of those early pieces of equipment, such as the feeding chair, just the positioning chairs, we covered it. We just bought it because that's what he needed.
Wow, that was out of pocket.
Yes. And so very expensive chairs. I mean, just, $200 to $500 easy.
Yeah, that's right.
Yeah.
That's right. That's a critical point that you talk about, because you do need like a PT or OT to write, the letter of necessity for those equipments. Yeah, that's right. So when did you start? So we had the equipments down, and then when did you start getting services through OT and PT?
So we started getting services through OT and PT. Once CJ, I'm going to say he may have been around 2 years old. We started taking him to a local PT and OT pediatric clinic. It's actually two sisters. One is a PT, one is an OT.
Oh, that's awesome.
Yeah. And so he would go there, and I'm going to say at least 3 times a week. And he would get PT services and OT services while he was there. So my wife would pick him up. Again, my schedule went back to a normal schedule, doing construction work. So you have a road torn up, you just can't leave because you got to take a child to an appointment. So my wife's schedule was, she went to work at about 7 o'clock in the morning. She would get off maybe around 3:30. She would take him to the appointment, which exhausted her. I mean, this is like a 10-hour day, 3 times a week on top of your regular schedule. And right. Then she had to come home, do homework, prepare dinner. And as my schedule permitted, I would, try to assist as much as possible.
Wow. And how long did that go on for? Well,
I'm gonna definitely say that went on probably for about two, maybe a year and a half. And that's when I started saying, hey, something has to change. I have to know more because I have to be able to help more.
Right.
Just seeing her being really exhausted. So that's when I started going to school myself.
Wow. That was the turning point. That's awesome.
Yeah.
And I just wanted to go back to early intervention services. You talked about the specialists, but was there no PT or OT who came through the EI at that time?
There wasn't right off. And I want to say that the PT and OT probably started around the time that he was getting ready to go to the early intervention as part of the Winston-Salem Forsyth County school system.
Okay.
And once he went there, that's when they indicated he could benefit from PT and OT. So we got the script to start taking him to the outpatient clinic. We also he started getting PT and OT in the children's school that he went to.
So that might have been about 3 years?
Yes.
Onwards. Okay.
Yeah.
Okay. That's interesting. So since that, could you talk us through about what school looked like for him as well?
Oh, well, school was very fun. CJ was very engaging. I really saw his personality and who he is becoming, within his own self. So he just captured everybody's attention. He became a favorite at the school. The PT, the OTs really liked working with him. And what was unique is I had started my physical therapy assistant program, and one of my fieldwork placements was at the school, at his school. Yeah. And not that I had any inkling to become a pediatric, but I wanted to be his pediatric therapist. I wanted to know enough about it so that I could take care of him.
Nice. It's I think it's such a powerful statement because there are a lot of families that I treat to the parents, who will tell me like, yeah, I think I want to go back to school for that very reason, Mm-hmm. And I also feel because of that passion where they come from, not just for the child, but when they deliver services for another child, it's from a completely different level as well.
So school early on, I would definitely say he was getting the equipment that he needed. He was also going to Amos Cottage, which was a clinic here where he would go every so often, and the interdisciplinary team would come together. So to see what his development was, to see how far he was coming along.
And how often was that?
That was, I'm going to say, maybe once every month or so.
Okay.
Early on, that we would go to Amos Cottage, and then Amos Cottage transitioned from the facility behind Forsyth into the Stick Center, which is on the campus of Wake Forest Baptist.
Okay.
And so that's when he started getting the treatment at the hospital. He was getting PT and OT at the hospital. Also the outpatient plus. So he was getting a lot of services. The only thing about getting so many services is the stretch on the parent who takes him to all these appointments. So we couldn't just have, my mom or her mom take him, because we wanted to be able to understand what was going on.
Right. Yeah. And because you also had to do follow through with home programs as well.
Exactly. Yes. So, how often does he need to be in this standard? So by this time he's getting in a standard. They're telling us that he needs to be in a standard at least, I think they may have said 6 hours a day.
And break it up. Yeah.
Yes. And so that is definitely challenging. And so we got a standard, we got wheels on it so that we could roll him in a standard throughout the house so that he could be with the family, and just see the dynamics of everything that was happening. And he was very curious. So he wanted to be.
Oh, that's awesome.
Where the rest of the kids were at. If they were playing the games, he wanted to be playing the games. Even though I tell him now that he really wasn't playing the game, they gave him a controller that wasn't even hooked up.
Oh, you told him that now?
Yes. Yes.
Oh, that's awesome. So I guess from what you're saying, also the family needs to be very organized, right? Because
Yes, the family needs to be organized. I would definitely say the space needs to be organized, because there's a lot of equipment. These little benches only can accommodate a child for a certain period before they outgrow it.
Yeah.
And because you spent money, you spent $200, $300 on this little piece of equipment, you don't want to just chuck it out. You're trying to find somebody else who can benefit.
Right.
But every child is different. So, I can remember us having a lot of equipment in our little playroom, our sitting room. And so what I mean by organization is making sure that you have the equipment where you need it. So, of course, his feeding chair or his positioner in the kitchen, if we were eating there, his little bench close to about where his toys were, so that we could get that sitting time in, and of course the standing time, and then cleaning the equipment. So yes, a lot of.
All right. Did it space out with the other kids to help out as well with the cleaning?
So they were definitely helping out, able to distract him sometimes with, just being goofy and dancing around him while he's in the stander, because I don't think no kid wants to be stuck in a stander.
Yep, for 2 hours at a time. Yep, yeah. That's right.
Yeah.
So thank you for talking about even the equipments and, what it's like even in the home, because we give the equipments, but then now it's in the home and you have to kind of organize it in the house itself.
Mm-hmm. Yeah, making adjustments to the equipment, because remember, this child is growing, and this is one of those times that he's growing really fast. And I'm 6'2", so CJ is pretty tall. I can remember my wife picking him up one day and his legs hanging down near her legs.
Wow.
And so he's definitely always been a very thin and wiry build.
Uh-huh.
And, so we had to always be making adjustments to the equipment. Again, his tone. Some days he could sit up very well. You could look away and look back for a minute, and before you know it, he's leaning one way, looking very awkward in the equipment. He's saying that he's tired, so he didn't want to sit in the equipment. So we learned how to position him in the corner of the couch.
Right. Yeah.
Yeah.
Awesome. So that was in school. He also received PT and OT too.
Yes.
So, okay.
And it's I would say at the school that CJ went to, and because I had my first field work there, it was very integrated into his learning.
Okay.
So this school and most of his peers had different development or disabilities. So you might see 2 kids in standers, 2 in rifting chairs or positioning chairs, 1 or 2 on a bench with just a lower lumbar support.
Right.
And then it might be 1 or 2 typical kids at that table.
Right.
And
how many kids were there in the school at that time, in the classroom?
I'm gonna say it may have been like 6 in this classroom early on.
Awesome. And so did you, I believe you were involved in the IEPs as well.
Oh, yes, definitely involved in the IEPs, where it was the LEA, the learning, I forget exactly what learning education person or administrator. I think that's what it is. And then there was the teacher, of course, the PT, the OT. We knew from the beginning he didn't need speech, especially not for talking, because he could talk. And then CJ had a pretty good appetite. So he developed his ability to manage food, finger foods, for the sake of him being able to pick it up to feed himself. So that was pretty much the team. And of course, me and my wife would be at the IEP. And we thought the IEPs worked very well. They worked very well at that school setting. I would say as he kind of progressed through the school settings, you had to be more aware and very cognizant of what you wanted for your child, because then it starts becoming more of a production versus a attention to what your child needs.
So do tell us about the difference when he changed in age, what the difference was with the IEP.
I would say the IEP change for me, from my perspective, it seemed more rushed. It seemed less focused on what his individual needs were, even though the IEP is for meeting his specific needs. And I guess this is a challenge with the school system, because it was like, this is what he needs. This is how often he's going to have PT, OT. Sometimes the OT would say, well, I will only want to be in as a consultant in the classroom, but not really providing hands-on services. So I would say I noticed flaws in how they were delivering services. And me being a part of the OT and PT discipline, I'm not saying that the professionals didn't want to do it. It was they had so many kids that they were responsible for that a lot of times I felt that his specific needs were not being met. And one challenge with that, I will say, is that as a child transitions from a more medical model to a school model, most times this is not explained to parents.
Right.
We don't know that most of the services are based on them being able to do the things that they need to do in school. We think the therapist is still going to provide some hand over hand, writing interventions,
Right.
still doing some type of mobility interventions, because we felt that one of his main things he wanted was to be able to keep up with his peers.
Right.
But we noticed that, his gait trainers was not being utilized. He wouldn't do as much standing in the classroom. So it would force us to have to put him in the standard for longer periods of times at home.
Okay. Yeah, that's a very critical piece of information that parents don't understand. Sometimes when they leave EI, they'll say, well, he's going to get PTOT in school. And I'm like, that's really different from what you get from an outpatient service, Yeah.
Yes, definitely different. So with that, we had to continue his services. And as he got bigger, we transitioned his outpatient services to comp rehab versus the outpatient peds clinic, because we just thought he needed to be challenged more.
Okay.
At this time, it hadn't been said whether he was going to be a functional ambulator. So we really hadn't put him in a power chair just yet. We were still hoping that he would get some type of abilities to walk, where if it was just walking to complete ADLs.
Right.
So he would continue his OTPT treatments at comp rehab and also get OT and PT in school. The early intervention specialists, were no longer coming out to the house. We would just go for his follow-up appointments with the doctor.
Were you aware by 3 years of age that the EI services were ending at that time?
We were kind of aware. And like I said, it wasn't as important because we knew that he was being seen in school. And the early intervention specialists for what I know is they really engage with the child. So it wasn't a specific thing to where he needed someone to help with feeding. No one needed to be trained as far as his feeding because all of that had taken place earlier.
Okay.
And so we were very happy with the services that had taken place in our babysitter's home, because that's where the EI specialist was going.
Okay.
And they had actually become very good friends. And, she didn't realize so much went into early intervention specialists. And I'm speaking of his babysitter at that time.
Right. Okay. Awesome. She probably was firsthand watching the whole thing, and she was getting trained as well.
Yeah. And I really appreciate her because she opened up her home. I mean, everything in her home is still going on normally. And here comes this stranger that she allowed to come in to help our son. So I'm very appreciative of her for allowing that.
That's awesome. It seems like you had a really nice, good support system that you were able to carve out for your child. So when he went into middle school and then into high school, what were the challenges that you had, that he faced?
Okay, so going into middle school, his middle school and his elementary school were two of the newer schools that was built in the district. However, neither of these schools had electric doors. Okay. So by the time he went into middle school, they had just installed the electric door on his elementary school. And we went over to visit the middle school to see exactly what his environment would look like. What type of adaptations or modifications had they made to accommodate him? So one good thing, this school was one level. There was no stairs or things that would be barriers for him to,
Mhm.
interact with his peers. However, it wasn't an electric door. A lot of the adaptive equipment that had to be brought in for his gym. So he had adaptive gym person come out. I don't forgot the exact name of it, but someone would come out to make sure anything that they were doing in the school while he was getting gym, that he would be able to participate in some kind of way.
Wonderful. Well, that is so awesome. So was he wheelchair bound at this time, or was he?
Yes, he was wheelchair. He had gotten a power chair at this time. We transitioned from a manual to a power chair. Like I say, pretty much the standards at school were not a thing anymore. He had actually had new standards and gait trainers here in the home.
Okay. And so with the electric doors, he was able to kind of maneuver in, out, like independently, move around.
Somewhat.
Okay.
The first place that they put the button for the manual, he couldn't get to it because no one ever sat in a chair and said, okay, I'm a child in the chair and I want to be able to touch this button to
Right.
get to it.
What height? Oh my goodness.
Yeah, so that had to be moved. And of course, we were patient. Then there were some doors in the school that we also, cafeteria, he wants to be able to move around. And I really think that these environmental features can have an impact on the child's independence or level of independence.
Right.
If you teach them to wait on someone to open doors, they're never going to just roll up to a button and push it.
Yep.
Almost like a second thought. So with all of these things being integrated, either at the time that he's at the school or after, really impacted his level of independence and how he looks at doing things on his own.
How long ago was that, when he was in elementary? And
I'm going to say at least he is 25 now, so maybe 15 years ago.
That's awesome. So 15 years ago, they were already thinking about that. That's awesome.
So he transitioned. So because the electric doors wasn't in place at his middle school or wasn't appropriately positioned, we actually added that in the IEP for transitioning to high school.
Okay.
One of the goals was he was going to be able to roll out of his van up to the school door and be able to open the school door and go in like every other kid.
That is awesome.
And so we worked on that. However, we did have an accident where one day he was in his chair and he went off the curve.
Oh.
And so it shook him up. We took him to the emergency room. There was no damage or anything. It just pretty much shook him up, but he became nauseated. So that was the reason why we wanted to make sure. But what we found out with this is he had a depth perception issue.
Okay.
So all of the schools then, because they were so nervous, they went and made sure that all of the handicap placards were painted on the parking lot.
Okay.
And that he could differentiate where there was a cutout for him to go off the curve to come into the van. And so it actually changed the high school before he got there, because then they said, oh, he had that accident. What did y'all do to remedy it? We told him about making sure that the paintings were there, telling him exactly where he can come off the sidewalk into the parking lot to load and unload in the van.
That's great, though. I guess he kind of pioneered that.
Yes.
Everything that happened, like there was a remedy, and now you have the visual cues for him. So that's awesome.
And so by the time he gets to high school, of course, he's in the chair. He has some EC classes. He's in these classes. He's very involved in the school. He was actually honorary football captain of the football team.
Wow.
Yeah, he was the prom king. So has the social supports that any kid would want in high school, which is the most important thing. But I would say he flourished academically as well.
That's awesome.
So a lot of things that some of the teachers early on didn't think was possible because they were so, I guess, just so focused on the traditional way of teaching and learning that they didn't know how to help him. And because our expectations was you're going to teach him the way that you teach everybody else, and we have the same expectations for him as our other kids as far as learning goes.
That's awesome. And so that set the stage even for him to view himself like I have to be on par with my peers. That's great.
Mm-hmm. Yeah. So he did well. Student of the year. So I would definitely say the transitions were rough, but they worked out in his favor. He had a great high school. I'm gonna say middle school was pretty good, but high school, because we learned so much from elementary to middle, that by the time he got to high school, a lot of things were in place. He also had a one-on-one for middle and high, but I would say middle school, the one-on-one really didn't know their role. And so as he's becoming more social, the one-on-one didn't understand, okay, this kid doesn't want me around all the time in lunch.
Right.
Sometimes when I'm with my friends, I want you to back off and give me space.
Right. And with the one-on-one, did you guys have opportunity of speaking with the person or? Yeah.
Oh, yes. So what happened is by the end of middle school, transitioning into high school, we would actually pull up in the parking lot, myself or my wife. We would get out, we would hook his book bag on the back of his chair, and he would roll out, and the one-on-one would see him as he went into the electric door. And we would tell him, we want to see him push the button and go in.
Nice.
Yeah.
Nice. And so that was throughout his time during high school when he had the one-on-one as well?
Yes, he had the one-on-one. And I would say the one-on-one in high school started saying, okay, I can see what he wants. So he would back off. And this is the first time he had a male. No, he had a male one-on-one in middle school too. But in high school, the one-on-one was more age appropriate for him. I would say it was a person that was younger, so they understood how to be a wingman, I guess.
Oh, that's awesome. So someone he could actually talk to as well, like a good.
Yes, and they became very close.
Oh, that's awesome. That's wonderful. Do they still have a relationship or?
Yes, they do. They talk. The one-on-one was actually also an assistant coach of the football team. So now when we go to the football games at that high school, he's still there and they speak and
oh, that's wonderful.
Read each other. So
that connection. And so after high school, what did he do?
So after high school, of course, the plan is to go to college. We went and visit a program that they have over at UNCG. It's called Beyond Academics. And we really had our heart set on that program, but I really don't think it was the program for CJ.
Okay.
You know, it's a program that's mainly built on the person becoming individual, taking care of themselves. Of course, they live in off-campus and on-campus housing. And they have somewhat of a one-on-one. But it's not the academics piece that we foreseen CJ being able to get. You know, it's like a watered down academics, but we're going to do more ADL independent care. And so that was cool. Some of the education model was built on arts and things of that nature. So CJ was very interested in making music. He has always, since he was, I'm going to say 3 or 4. Our ritual was to get up on Saturday mornings and listen to jazz and then hip hop and R&B. That was our thing.
Does he play any instruments?
He does. He played the drums in school, and he also uses turntables. So he mixes music.
Nice.
That's his thing. Yeah. So he loves hip hop. He goes to a lot of concerts. But getting back to school, so after we figured out that the Beyond Academics at the UNCG campus wasn't the program for him. We started saying, okay, CJ, what is it that you want to do? And so he says he wanted to be a DJ. So I said, why don't you go for communications? And so he started a communications degree over at Forsyth Tech. And we were going there, we were taking one class a semester. And then, of course, COVID hit.
Oh, dear.
Yeah. So, of course, he didn't graduate from school like at 18. He actually stayed, I think they can stay until they're 19 or 20.
About 22, I think.
Yes. So he did stay for one additional year.
Okay.
Yeah. And then by then his class had moved on. So he didn't want to be there anyway.
Okay.
Yeah. Because
sorry, go ahead.
I think progressing and, transitioning with his peers, the same people that he went to middle school. So we stayed in the same district.
Right, right.
So all of these people, all of his friends were at this school. They transitioned from elementary to middle to high school, which was very important for him. Right. So by the time they were leaving high school, he wanted to be leaving as well.
Nice. Yeah, because the camaraderie with the friends. How does he find his communication classes right now? Is he still in school right now?
He hadn't went back. We actually did some of the classes online, but he hadn't went back to school because even the online learning, the expectations. Okay, so once you leave school, there's no more of I'm trying to think of the right term for it, where the ADA compliance and all of that is when you're in high school. Well, ADA, of course, they have to make it accessible to you, but there's no requirements on the college institution where they have to change the curriculum.
Oh, okay.
Yeah. So the modifications that he may have received, they give him a syllabus like they give every other child, and it's up to a one-on-one or parent support to actually make sure that he can access the things that he needs.
Okay.
So that has been a barrier as far as college is concerned. They can have some accommodations, but some of the accommodations aren't ready for a child or an individual with certain disabilities.
They have like a department for disability rights?
It is a department for disabilities. And of course, that pretty much says that they're just going to make sure that you can get into the classroom, you can get close enough to the board to read it. But, that's where it pretty much stops.
Okay.
If you don't have a device that you're used to. So he has used Apple iPads since they came out and were available to the public, pretty much. And so it's getting his iPad set up. And then they use certain programs like Blackboard, which is the learning management system. We use Canvas, of course.
Right.
So then it's navigating Blackboard, being able to use electronic books. He doesn't write, scribe. So he has to tell you what his answer is so that you can actually write down. He does make comments. He would always comment verbally in class and add to the discussion. But sometimes I would really see where instructors wouldn't be as open to find out what his abilities were. So sometimes they wouldn't call on him or say, CJ, what do you think about that?
Right. Yeah. That's a different level of issues to deal with. Yeah. But I think we are seeing more of a surge of children with special needs, now young adults, actually going to the next level, and I think that's my personal opinion. I think the system has to catch up,
For sure.
Right?
For sure.
Because
I would go ahead.
No, because they kind of think, okay, right up to high school, but these kids with special needs have thrived and overcome so many hurdles. And now they're in college, or tech schools or whatever. But I don't know if they are adapted enough. The system is adapted enough for these kids. Yeah.
Yes, I would agree 100%. And just looking at curriculum, is the curriculum suitable? And I don't mean water down courses. I mean to make courses to where they're more three-dimensional versus one-dimensional paper, words on paper.
Yeah, definitely thinking outside the box there. Hopefully someone will listen to this as well, or there's an opportunity for, people to hear, because there's a lot more kids these children who are going, and they're thriving because they're so excited, to learn and get to that next level. I want to change the course a little bit here, but thank you so much, because that's a fascinating journey, that he's gone through and where he is right now. And I'm sure you guys will be finding some solution for where he is, because you've remedied a lot of different situations throughout his life. Can you talk a little bit about the financial legacy of planning?
Yeah, so I would say that's something that has always been on our mind, as far as what happens if we're not here? What happens next, as far as CJ is concerned? So CAP insurance was definitely something that was just valuable to us. So CAP insurance pretty much meets his needs as far as equipment is concerned, because as you transition to an adult, the needs become even more. So typically what that looks like is a person that has never worked with disabilities may get $400 a month from SSI. So $400 a month pretty much can't take care of gas at this point.
Right. You're right.
Yeah, let alone food, clothing, leisure, and college expenses. So with CAP, it is a way of us being able to get accommodations to our house, him to get the equipment needs that he needs. We were able to, right before he left high school, is to get a stand-up wheelchair.
Okay.
He's not a functional ambulator, but having a stand-up wheelchair at least puts him at eye level with his peers, when doing appropriate, when it's appropriate, which means a lot. Or being able to rise the level of his chair up to, let's say, bar stool seating.
Right.
So CAP will actually pay for a lot of accommodations. They make sure that all of his medical needs are being met through his insurance, and also things out in the community that he's interested in. And so, of course, we started saving. Up until a couple of years ago, a person with disabilities and getting any type of income, they would actually cut the amount that they would get. So you could only have so much money in an account as a person with a disability if you were going to continue to get monies from the government.
Why?
I don't know. And I think that has recently changed, but I know at one time it was $2,000. He could never have more than $2,000 in his account.
Okay. So you got to spend that amount before
Yes.
more comes in. Okay.
Yeah. So, just having a way. So thinking about where was he going to live if something happened. So our first home that we purchased, we always maintained it. We rented it out so that one day he would have a home. We also have done a plan pretty much every year that says what CJ needs, what are his stressors, what are the things that he have to prevent him from not being able to do his everyday. So we know that he needs someone to be able to care for him as far as his ADLs, helping him with bathing and dressing, what type of foods he likes, preparing his meals. He can feed himself, he can hydrate himself, but those things have to be brought to him until he's up in his chair, his power chair, to be able to get into the kitchen wherever those meals are taking place.
And is CJ aware of his needs?
Oh yes, he would definitely make his needs aware, known. So his iPad is one thing that he has to have, and it's actually indicated in our plan for him. He has to have his iPad. It has to be in working order. He has to have Wi-Fi so that he could communicate to the outside world if need be. So he's very active on social media. Um, he calls his friends, he does FaceTime. Um, he has music up that he listens to and also puts out.
Nice.
Yeah, so those are some of the things that we've outlined in the plan for him. Now, as far as family members who he said that he wants to be a part, my younger brother, they're closer in age. So he really looks at my younger brother as being a person that he would want to be around to kind of manage his day to day or help him manage his day to day, not to be responsible, but to help him manage it. And then, of course, he has an older brother and an older sister.
And when you say help him manage, could you expand on that a little bit?
And so when you talk about someone, not having the direct parent support, so financial management, making sure that his bills are paid, making sure that he has the food that he needs. And it's much easier now. You have DoorDash that can just about bring you anything in,
Right.
but CJ needs someone being with him. He always needs standby assistance. And the reason why we know this is because of that accident that happened in middle school where he went off the curb.
Right.
So we know getting in and out of the house, on and off of sidewalks, he has to have someone right there, or else he could have an accident.
Sorry, go ahead.
No, go ahead.
I was going to ask you, when did you start the financial planning for him? At what age?
I would say we started probably talking about it more as he got to middle school, because nobody wants to think about not being around for their kid when they're babies or elementary age.
Right.
But I would definitely say we started thinking more about that once he got right into middle school, and just making sure that we wanted him to understand that there are things that he needs in place, if we wasn't around. And so we know that he doesn't ever want to be in a facility. That's one of the things. So we do have a home that our plan is for him to transition into it, to become more independent, to have that one-on-one services that CAP will provide.
And can I ask you, did you have to shop around? How did you know where to go and which plan to pick for the financial legacy?
As far as, we don't have, I guess, a formalized plan for it. It's more of our insurance accounts.
Okay.
One thing, CJ is his guardian. We've always allowed him to be his guardian. And we did that for a specific reason, is because if he's his guardian, if something happened to us, he still has a voice in what happens with him.
Right.
Whereas if he's without a guardian, I'm sure that the state just becomes your guardian naturally if your mother and father are not around.
That's such an important thing to highlight, that you want to have, especially with him being so independent, he knows what he wants and he needs. So that will be really, really powerful to have that. And you have that in place. That's awesome.
Yeah. And so, we've always explained to him it's tricky, but at the same time important, because we don't want people to be able to take care of him. Take advantage of him.
Right.
But at the same time, we do want him to be able to advocate for himself and to say what he wants in life. And as this world changes drastically, we want him to be able to say, okay, CJ wants this. CJ don't want to be in a facility, and I can make that decision because I'm my guardian. I'm my own guardian.
That is so amazing what you've done as a family, and him coming, turning out into this young man who's now, waiting to see what he wants to do next. And so ambitious, he's so ambitious. That's wonderful. I want to thank you so much for taking this time, for sharing this journey, and especially, it's going to be so powerful for other families listening to this as well. I'm going to ask families if they have any questions to share that with me so that I can pass it on to you. or if you want to share that, let them reach out to you. I'll leave that to you as well. But thank you so much. Today, Dr. Ingram shared with us the life journey from the time of birth, which is it was so nice just listening to you. The whole journey that the child has gone through, now a young man, and a young man who's gone through all the different adversities, but making it his own, and now finding a possible career for himself as well. And the fact that you have also worked out the financial legacy and the cap that you talked about, the SSI, which I think is so powerful, and is something that every family with a child with a special need should look into, to make sure that those areas are also covered.
Yeah, because working is something that's important. He wants to work, he wants to go out, but then if you work, how does that impact your ability to get your monies, or does your insurance actually cut back on services because now you're making your own money? So definitely something important for families to negotiate. And if I find out more information, I will be glad to share it as this journey continues.
Right. Thank you so much again. I hope that we can get you back again to talk a little bit more about his journey as well and what's happening. But once again, thank you so much. And I appreciate your time with us today. Thank you, Dr. Ingram.
Thank you.
Thank you. Bye-bye. Hi there. To wrap up today's episode with Mr. Dr. Ingram, he walked us through his journey as a parent of a child with special needs, walking through a time in the NICU, through high school, middle school, and then now as a young adult. He's walked through the different systems of care that he has personally gone through, and also the financial legacy, how they looked out to make sure that the child will be taken care of into his adult years, and also giving the child the independence of thinking, thinking through what he wants, what he needs to do, and also giving guardianship to the child so that he has a voice. That's a very powerful statement, that the child is independent, he knows what he needs, and he has the voice to say what he wants. We want Dr. Ingram to come back to answer a few more questions. I'll be happy to bring him back, especially with respite care. That's something else that comes up quite often with my families that I deal with. But I'm excited to let you know that my next episode is going to be with Dr. Sherry Stancliffe, who was also a school occupational therapist, and she's going to walk through with us, what to expect in the school system, what the constraints are in the school system itself, and what the IEP systems are, what the mandates are. So what your expectations should be with the school system itself. At this point, I also want to share with you that I have written a book, The SI Solution, The Definitive Family Guide to Thriving During Sensory Integration Dysfunction. And that is really geared towards parents. In that book, I have different kinds of strategies for different issues, from sleeping to, to eating, to play, to bathing solutions that are in there. So it's written in a very friendly manner, user-friendly manner for parents to understand. And you can find that both from my website and also on Amazon. I look forward to hearing from you, seeing you guys, joining us at the next episode. Thank you so much. Bye-bye.